Hi.
you?
I'm
Excellent.
great. How are you? It is always so nice to see you. I know we're
Yeah.
waiting for some people to
Yes,
join,
I'm
but
so
this should be
excited to have
fun.
this conversation today and to talk to everyone. Thanks for doing this.
No, no, I love it too. Me too. And I can't wait for everybody to hear what you have to say because everything you're doing is just, I
Thank
think,
you.
so important and
Thank
so
you.
incredible, as always. I think we're just going to wait for some, I don't know how many people will join us today, but we'll give it a minute because it looks like they're all logging in. All right, so I think we could probably go ahead and get started. I mean, we'll do introductions, and as people join, they can hear more, and we'll probably be in the thick of it by then. Um, so I'm so excited to be doing this today. First of all, excited because it's my first one and I'm learning how to do it. But even more excited that you're joining me for my very first one. I couldn't think of a better person to do this with. By way of introductions, my name is Sarah Dorsett. For those who haven't seen me before, I'm the CEO. I've been the CEO of Nanit for almost 5 years now. Leading a vision that we hope will change the world for the better, for parents, for families, for children. And as you and I have built a relationship and talked, I also really hope to make life better for women and women's health as well. So it's personal, very personal for me to do that. And so meeting you was kind of a dream come true. But I'm really excited to be joined today to basically grill Dr. Tara on all of the amazing work that she's done in the in the women's health space. I guess I'll let you kind of introduce yourself a little bit if you want to just tell a little bit about who you are, and we can kind of get started. Because I think coming from you, it's always it's always better than
I'm
coming
happy
from
to
me.
start. I'm happy to
So
start. So I am Tara Shirazian. I'm an OBGYN. I'm based out of New York. New York City is actually home. The back of you here is New York City. I practice here in the city, but I started Saving Mothers about, over a decade ago. It was 2009. So that is now 14. We're going on 14 years at Saving Mothers, which is really, really exciting. And Saving Mothers is a global nonprofit that's dedicated to eradicating maternal death and morbidity. So maternal death in pregnancy, at delivery, postpartum. Also, we focus on reproductive health and access. And in addition, especially over time, we've added safe surgery for women, gynecologic surgery, and access to those specialists as well. And we work many places in the globe. I feel very fortunate that I've been able to travel across Africa and learn about systems of care and kind of learn about what women confront in the most rural areas of the globe. So we create programs that teach and train their local providers. And these programs are sustainable because after we teach and train the local providers, we leave them with the communities. And we have a team in place in each country that helps continue our efforts even when we're not physically there. So it's really been my honor to be able to do this. I really feel like Saving Mothers is my way of giving back in the world and making sure that all women have access, so that even though I'm in New York City, hopefully the people we teach and train and the programs we put in place will continue to benefit, women everywhere around the globe.
absolutely amazing. If I could ask, I think one of the things that I was surprised about was that this still is an issue. Because I'd love to hear how you think about prevention and the state of the world today. I have heard stats that the morbidity rate
Yeah,
in the U.S. is actually
it is.
potentially going up, which shocks me. A developing, the fact that that could actually happen. So, what is the state
Yes,
of the
it's
world, and why do
actually,
these
I'm
things
so
still
glad you asked
happen?
that question, because just recently I looked at just the statistics. What are the stats surrounding maternal death around the world? And let's start with the US. The US ranks at very, very low compared to other high resource countries. So actually, in terms of maternal death, we rank 124th in the world. So that is staggering, you know. Our rate of maternal death is something like 34 per 100,000 women, which is actually a very high rate, when in like Norway and Sweden, it's maybe like 7 per 100,000 women. So you can tell 7 versus 34, how much higher our rates of maternal death are. And there are many things that contribute to this, many, many things. But when we look at the underlying causes for maternal death in the United States, it's things like preeclampsia, which is high blood pressure during pregnancy, or a blood clot to the lungs, which we call pulmonary embolism, or cardiomyopathy, which is a complication of, you know, having a heart that's not working as well as it could during pregnancy. So we see a lot of drivers of death that are not necessarily the same things we see globally. Like globally, postpartum hemorrhage is number 1. And here it's probably more like number 3 or 4 in terms of causes of death. So we see nuances between why are women dying. But I can say the US has an unacceptably high rate of maternal death. And in addition to that, we actually also have very high rates of racial disparity when it comes to maternal death. And our program in New York focuses on this disparity. So we're actually modeling a program that does outreach to our Black and Brown communities that have very high rates of maternal death in the most underserved areas of the city. So there's lots of nuances, but I do think there's a lot we can do. The big thing to know is that more than 80% of all deaths everywhere, US or globally, are preventable. So that is the most important thing. These are preventable deaths that we can do something about. So that's really been our focus. How can we prevent? How can we empower? How can we change? How can we change the world, really?
And that's one of the reasons why I was so committed to have Nanit partner with you. And it's a new partnership, and I'm so excited about it. Because once I learned all of this, I thought, oh my gosh, this fits perfectly.
I
you
love
know,
that.
We need to take care of our mamas,
we're in
right?
sync with that. We really, I know we both really feel strongly that every woman should have access, that we can prevent these deaths. And there's a lot that we can do as individuals and as a community. So that's why I'm here.
Yeah, well, I'm such a bleeding heart with Nanit, right? I'm always like, look at how wonderful life should be with your baby. And when you have your baby and then you think, oh my gosh, you know, you're starting that life and then losing one at the same time, that to me just is devastating. It gives me chills to even think about. So the other thing I'm very curious about is just, are there some basic things that people can do, or are there some early things, you know, that people, you know, socioeconomically, regardless of where they sit, can do to help prevent and take care of themselves better so that they can reduce the risk, you know, regardless of their economic state, or even
100%.
racially?
So actually here in New York, we make these Empower kits. They're kits that we give out to our underserved communities for free. And in them, and I think a lot of the principles of the kit, every woman who's pregnant should understand. Really, everyone should understand. So the kit is about understanding your risks in pregnancy, just knowing what could happen. You know, I think we think of pregnancy in the United States as like this wonderful, beautiful, you know, and it is. It's a wonderful time. It's a beautiful baby. You know, I'm a mother myself. I understand, like, it's sort of all about the baby. And we think about, oh, how can we buy the baby things and make sure that the baby is comfortable? But I would just encourage women to also think about themselves. Like, that is the best way to make sure that you are going to have a healthy pregnancy. You want to know what could happen, right? And you don't want to know it because you want to be anxious about it, but you want to know it so that if you have any sort of symptoms that seem unusual or signs that seem unusual, that you feel comfortable talking to your doctor about it, bringing it to your doctor, your midwife, your nurse, even your doula, whoever is there with you that you feel comfortable with. So that's really what our kit is about. It's about understanding medical risks and then knowing how to talk to your doctors or your healthcare providers about it. So we also empower women through like teaching them verbal strategies to communicate. And That's actually a big thing. So sometimes it's not, you know, you go to the doctor, right? And you're like, wait, what was I supposed to ask the doctor? Like, what are my questions? Should I be asking something that I'm not asking? So I actually think that health communication is, it's difficult for everybody, not just pregnant women, not just underserved women. Everybody across the board finds navigating the medical systems difficult. So we teach our women about empowerment through verbal strategies and techniques for communication and understanding their medical risks. I would say those are the most important things.
Amazing. I think what's really interesting about that, and I don't talk about this enough, I probably will in the future. We talk a lot about what you can learn from Nanit and your experience with Nanit, and what you can learn about your baby and about your own habits and things that you can do to make those even better and healthier. But one thing that we believe is the future of Nanit as well is being able to have really meaningful conversations and relationships with your pediatrician, and also maybe your OBGYN. So taking that data, understanding yourself and your habits, and feeling like you can really have a meaningful conversation and develop that relationship with your doctors. That's something that's crazy, really very, very important to us, and also crazy to think about when you think, wait, is there a breakdown there potentially? You know, is this something that's actually has to be learned? And it sounds like more and more, because the world is so busy and so crazy, and everybody is short on time, that those communication skills are becoming more and more and more important. And having the right information and knowing how to ask the right questions and how to think about the right questions to ask, even though that might take a little bit of extra time, actually really saves you on the back end when you're having those conversations. So that's incredible that you have that kind of, you've identified that communication is so important, and you've developed a system for that. And also, I also just wanted to ask, with Saving Mothers, I think you mentioned you definitely have a track, and that focuses on developing countries and what's going on there, and that also really resonated with me, because equal care across the board and equal opportunity across the board is something, or globally, is something that I think we both really care about. What kinds of things have you guys already impacted or done in these developing countries? Probably looks a lot different from the types of things that you would do in the US.
You know, we started with Saving Mothers in the global setting, and we bring a lot of what we've learned globally here to our local setting. And so what I want people to recognize is that, yes, our rates of maternal death are really high. Let's say it's 34 per 100,000. In Kenya, where we work, it's 334 per 100,000. So it's a degree thing. Right? So we have maternal death across the board in every country, but it's a degree thing in the low resource settings where really there is no one sometimes to help take care of the pregnant woman. So that is why we do have a lot of focus globally. We've been really excited because we've been able to do a lot globally already in the 14 years that we've been a nonprofit. So in Guatemala, for example, where we work in the very rural area with the indigenous women, we've built up a school for traditional birth attendants. So we've taught the women at bedside, the birth attendants at bedside with the women, how to provide prenatal care, how to be prenatal champions, we call them, for the women, how to get them into the hospital when they have complications or when they're worried about them. And that has built this entire cycle of new birth attendants that are like skilled, basically. And they're sought out now by the Ministry of Health to provide healthcare in other settings in their community centers. So we built this whole continuum of care for women. And the school is like, the old birth attendants are teaching the new birth attendants now. So it's like a cycle that goes on and on. So we're all about that. Like, how do we create a sustainable model that will last far beyond us ever being there? And in Kenya, which I think we're going to talk about Kenya, which is one of my very special sites. Yeah, let's talk Kenya.
Let's talk Kenya. Yes.
I love Kenya. We have been in Kenya, in a very rural area of Kenya that borders Uganda, since 2015. And so what I want to tell everyone is, for the very first time in West Pokot, we brought an ultrasound to that community. And when we first went out to the clinics in the very rural areas, and we brought our ultrasound and we encouraged the pregnant women to come and we scanned them, people were mesmerized, like that no one had ever seen their baby in utero. No one had ever seen an ultrasound. It's crazy. It's amazing.
That's amazing.
Never. And so the women, literally, at first, everyone was very shy and kind of timid, but they knew us because we had already been there kind of in the community, with the community. And the very first time I remember I scanned a pregnant woman, like just the look on her face, she was like, how's that? How can you see my baby? You know, it was crazy. You know, she was in awe. And the next day, 100 women were lined up outside the clinic. Like, the word spread immediately. And so now just basic ultrasound in the community has been such a big thing for us. So we're able to engage women through ultrasound screening early in pregnancy. That allows us to identify risks and complications earlier. We can get them into the clinics and hospitals earlier. And we have a system now where our community health workers help us, our traditional birth workers help us. They recruit the women, and we're able to get women into the clinics and hospitals much, much earlier. So our rates of safe birth have just gone up considerably. We've decreased infection rates. We've decreased maternal death rates. And we've also just created a system of care between those workers and the hospital that now allows trust and engages the women in the healthcare infrastructure, which I think is probably the most important thing, because you want women to trust their clinics and hospitals. It allows us to do so much more for them. And on the back end, we train up the doctors and the nurses and everyone else so that we create a sustainable kind of system of care.
Amazing. So when you and I first talked, we talked about a lot of different things. And there's even some entrepreneurial things that I want to touch on in a minute. But let's stick with Kenya for a second, because we've joined forces to try to raise money for a maternity portion built there. And I know you're leading the charge on that, and we're really excited. We have a fundraiser going, so anybody who wants to contribute, you can easily do that through both my Instagram feed and Get Nanit as well. So if you want to help build, we also have talked potentially about the use cases for Nanit, even to add a little more technology and that remote monitoring that we can do so well. So trying to find ways to also bring a little more of that technology to places like this, where it could be really useful and really valuable in a really unique way. We could learn a lot that we could also bring back here to the U.S. and partner on it. But tell me a little bit more about conditions there, why you wanted to do this, and what your vision is for.
I want to talk about the Kapinguria labor floor, because anyone who's been in labor or who's been pregnant, or even if you haven't and you've been to the hospital, everyone's sort of seen a labor floor. So at Kapinguria Hospital, which is the hospital that we work with in West Pokot, they do almost 8,000 deliveries a year. They are a very, very high volume hospital and center. There is a tiny little labor ward where women, when they labor in a bed together. They have a few beds, like 4 beds, and they labor multiple women in the bed together. So the women are sitting, like one is sitting on one corner of the bed, one maybe is lying down in one corner, and they are laboring. When it comes time for delivery, they move the woman from those 4 beds to one of 3 other beds that they will deliver in, but only at the very last minute. And these delivery beds are these tiny little beds that are all very close to each other. And, it's just not a great experience. And also, if you have a complication or a problem, it's very hard to know, what's happening. It's hard to provide good care, even because there's so many people together. It's very hard for the doctors and nurses to track sort of, what to do for each patient. So they're desperately in need of a labor floor. And I talked to one of the charge nurses there. I asked the locals whenever I want to know, like, well, what's the real situation? What do they think? I always ask our local people, our local teams. And so I asked the head nurse on the labor floor this last time. I said, you know, what do you think? Do you need a new labor floor? What do you think is the biggest problem with your current labor floor? And you know what she said? She said, well, Dr. Shirazian, it's definitely the bathroom. And I was like, oh, the bathroom. I didn't even think about the bathroom. I'm like, yeah, where's the bathroom? She shows me the bathroom. Okay. There's one bathroom on the whole floor. And it's this tiny, like, first off, they have very old traditional bathrooms. So there's just a hole in the ground. But the shower is one little shower. It does, half the time doesn't function. And you pull a string and you get like a small stream of water from the ceiling. And so what she was saying is, you know, many women, they'll deliver at once and they just want to like clean off. They just want to shower and there's nowhere to send them. There's nowhere to go. So, you know, it's not just about the convenience. It's also about safe care. So the other thing is when the babies deliver, there are no baby warmers. I don't know if I told you this before, but the thing they asked me for this last time was baby warmers. They don't have a single functional baby warmer to keep the babies warm. So I was trying to actually get some from our companies here in the US, but they don't have any baby warmers. Babies die very frequently in that area of the world because there is no baby warmer. There's no ICU. There's no monitoring. So I just think, you know, in many of these countries, women are used to that. They accept the fact that their baby may live or die at delivery. And so they also have very high rates of neonatal death. We see that a lot too. Yeah.
Oh my gosh. And you think it's shocking to still hear that, right? That people, that's when you get pregnant. You're like, well, there's a chance, you know, and I just have to kind of accept that that's the best I can get. Like with all the resources we have globally, it feels like that should be something that we can easily eradicate. So incredible everything that you're doing. Just to wrap that up, we are super excited to partner, and we're hoping to raise as much money as we possibly can together and through other, you know, any other donations and contributions to build that maternity wing.
Thank you.
I think
we're so excited for the project. So yeah, to wrap it up, we're partnering with the local hospital, the governor, the ministry. You know, it's really important that whenever we do a new project that the local team really be part of it and own it and help, you know, do it with us, basically, that we partner and collaborate. So we're very, very excited, and we're going to help them with, you know, how do we set up a floor that's maximally functional. So I should tell you, we're all about being practical and functional, and, you know, everything that we, every dollar that we raise, we really do put to a very practical and functional use that will be sustainable. That I can guarantee everyone. So a lot of thought will go into how to design the best floor at the least cost, that's maximally efficient, that would benefit the most number of mothers and women.
Amazing. I think one of the things that, you know, we really look at Nanit is, what do other countries do? How do they care for their children? You know, are there practices for sleep and health that we can actually add to our own product? Because there are definitely opportunities in other countries where they are successful at all sorts of different things. And I think what's really amazing about your story is you've identified a way, you know, you have education in one region, and then you've got a new maternity wing in another. So each country or each place where you bring, you know, support might demand something different, and you're learning about how to apply that. And that just means that we can move faster in the future for all of these causes and eradicate this, which I think is very achievable.
Yes, and necessary.
You know, when you think about it, when you think about what it takes, it just takes the attention and the right investment, which isn't huge. It's worth it. You know, it's worth it to save a life or multiple.
We make these, just on that note, in terms of how a little bit goes a long way. We make these small safe birth kits that we give out to the hospitals, we give out to the clinics, women use them in the home, and they cost about $15 to make them and to ship them. And so that $15 can literally save a woman's life. Like, it has everything in it that the provider would need to provide her with a safe delivery, as an example. So, you know, I think it doesn't necessarily have to be a lot. Every little bit helps, whatever folks can contribute, but they're contributing towards really sustainable solutions for women. And I think there's not enough emphasis on women's rights and women's health around the globe. Like, we definitely don't get an equal share of the pie, so to speak. So
I could not agree more.
Yeah.
And women, I think that we can, you know, we can validate that from our own personal experiences. And you have, I mean, even you saying that, because you already, you know how to care for yourself and others, but for you to say that yourself, I think goes a long way.
And we need the men, by the way, if there are men on this call, we need the men to help support our programs. We need this to be something that is, you know, non-gendered, and everyone wants to support the fact that, you know, women's rights and health are very, very important. Maternal deaths should not happen. Neonatal deaths shouldn't happen. And we should take steps to eliminate that. We should actively be working towards that, because it's a very important health issue.
I couldn't agree more. I'd also love to just hear a little bit more about some of the other things that you've done. So
Yeah.
Also partnered, or we've talked about Mommy Matters,
Yes.
And what that looks like, because you've done a lot more than saving mothers and your amazing career, you know, as a doctor and healthcare provider. You've also created businesses,
Yeah.
and products that support women. So I'd love to hear a little bit more about that too.
Yeah. So actually, this is now a few years ago, right before COVID. So maybe like 2019. I was trying to think about strategies to help all people be part of this community of giving back to mothers globally. So I created Mommy Matters. It was a small business. And the goal was to create practical products for mothers that really don't have a lot of exposure on the general marketplace, things that they could use daily when they're pregnant, like underwear. And, you know, the underwear that we create is all about comfort, all about being able to reuse the underwear. It's basically has this built-in ice pack for soothing of the perineum. We couple it with a spray, a numbing spray that's meant to really keep the perineum comfortable after a vaginal delivery. So we make these practical products. And with sales of the practical products, the portion goes back to saving mothers. So the goal of the company is to give back to the nonprofit. And so that really was the reason for even creating Mommy Matters. It was our baseline reason for making this company, creating this company. And we make a number of other products, again, very practical products that mothers need when they're pregnant, that will help with their care, both for themselves during and after delivery. And it's all about empowering mom. It's about making sure that the mother understands that she's important and valuable, and the things that we make, that we create for her, are to make her feel more empowered. And as she buys products for herself, she gives back to the community of mothers around the world. So we're all part of one community of women, and these products will help get back to the nonprofit work too.
I'm so glad that you're the one leading the charge on all of this. And I know we're probably running low on time, so maybe we should turn it over to
take some questions. Yeah.
Q&As. I want to make sure, and I am the worst person here to figure this out, where these questions
are. If anyone has any questions, they can put it in the chat. I don't see any there. Oh, I have a question. What can someone do as an individual to support saving mothers and help with the maternal health crisis? Well, many things. One thing is just awareness, Nicole. So just making sure that people know about the issues, I think, is super, super important. So sharing our posts, sharing all the material we post on Saving Mothers about maternal death and access to reproductive health. I think being part of the conversation is extremely important. So that's one. Two, we do take donations. We need donations, obviously, to make all of our programs run, but it does not have to be a large donation. Again, it can be small. It can be the price of a safe birth kit, which is $15. And that safe birth kit goes to the woman who's delivering. We really are a nonprofit, again, who we streamline our costs, and we really make sure that the money we raise goes to the programs, the women, and the teams that help support these programs. So yeah, so there's lots of ways. And if you wanted to be, if you're in New York and you wanted to help us, you know, sometimes we do kit packing. We send donations globally, and we need all hands on deck. We take volunteers that way as well.
Wonderful. So before we wrap up, are there any other questions? We probably have time for one or two more. And if not, I don't think I'm seeing any additional ones come in. Hopefully that means that we've answered everybody's questions.
Well, if anyone has questions, they can feel free to reach out to us directly. And how you can advocate for yourself is make sure you vote. That's always the big thing. Vote for issues that are pro women's health, vote for reproductive access, and make sure that, you know, we have people in Congress that help support these issues as well. There are lots of bills in Congress now, including the Mom of Us Act, that is about improving access to safe maternal health care in the United States. So I think that's always the big thing. And then advocating for yourself with your physician, making sure you know your own health, making sure you bring questions to the table. I think when pregnant and even beyond is vitally important to good healthcare encounters and making sure that you're seen and heard.
Well, thank you. So I guess the last thing I would say is, what's the best way to get in touch if you wanted to contribute, or you wanted to learn more, or you had additional questions?
Well, we have Nanit campaign, so everyone here can donate through your campaign and through the store. If you guys have questions for me, you can reach me at Saving Mothers. I'm also at Dr. Shirazian, and you know, people can feel free to ask me anything. Yeah.
Amazing. Well, thank you. It was so much. It's so nice to catch up with you and spend some time with you. Thank you for taking time out of your extremely busy life.
Thank you so much.
Okay.
Thanks everyone for tuning in, and thank you for caring about this issue. That's the last thing I'll say. I think caring about it is actually the best way to really make change. You know, again, raising awareness, talking about it, telling other people about it, I think is so vitally important to the issue.
I couldn't agree more. Yes. Thank you to everybody who tuned in to learn more. I really appreciate this, and I'll talk to you very soon.
Thank you. Thanks, Sarah.
Bye.
Bye.